ACL tears are becoming all too common in the sporting arena. For an injury that was once never heard of, recent years have seen it become more prevalent than ever. A new study shows that the rate of ACL tears among teens has been increasing about 2.3% per year for the past 2 decades. But what is quite alarming is research shows that females are more at risk than males, roughly 3 times more likely to sustain an ACL injury. But why? The combination of both anatomical and biomechanical differences. Studies show the peak age for females sustaining ACL injuries is 15 to 19. But if these young females participate in demanding competitive sports, their bodies become at even greater risk. Female athletes are 2 to 10 times more likely to sustain an ACL injury than their male counterparts. So, you might be thinking, what is your ACL and what exactly does it do? The anterior cruciate ligament is one of the key ligaments that help stabilise your knee joint. Connecting your thigh bone to your shin bone, this ligament keeps the knee from sliding, rotating and hyperextending when doing things like running, jumping and landing. You can understand why sports that involve sudden stops, changes in direction and harsh landings can lead to ACL injuries. Non-contact accounts for 70% of ACL cases, simply by doing the wrong movement. Female athletes sustain non-contact ACL tears at a rate 5 times higher than males. But when high knee loading tasks in sports occur at a similar level in both genders, we ask ourselves why. It has been theorised that females are at greater risk of knee injuries because their wider hips create a larger Q angle, that being the angle formed between their quadricep muscles and the patellar tendon. It proposes that the larger angle leads to things like knee valgus, where the knees cave inwards towards the midline of the body. As a result, the joint becomes at even greater risk when completing movements like jumping, lateral pivoting, landing and decelerating. Another theory is hormones. During puberty, males experience a rise in testosterone and increased muscle mass. Without this rise, young females need to partake in strength training in order to build muscle, improve control over their knees, and protect their ACLs. Cronulla Sharks and Australian Rugby League representative Taylor Preston is currently undergoing rehab after tearing her ACL in June. The 21-year-old saw her life come to a standstill. Both sport and work were impacted as she was forced to sit on the sideline for the remainder of the season. She talks me through the heartache and the repercussions, the recovery process and what needs to be achieved before she can return to sport.
Way line. So the first set of 6 here and they're looking good, aren't they? Now this is Preston, the captain. Is she about to get the first try in the Tasha Gale Cup? History right there.
So I played sport my whole life, since I was 5. And then I've been playing footy since I was 16, so for 5 years now. And yeah, sport's been a big part of my life.
And talk me through the moment you tore your ACL.
So that was a bit of a crappy moment, to be honest. We were just playing a touch drill and passed the ball and then my knee just gave way and I knew straight away that it was probably that, so I thought the worst. And yeah, it was not a very good moment. Bawled my eyes out straight away.
And what physical state were you in prior to your injury?
Personally, I felt like I was probably the fittest I'd been in a long time. During COVID, we had to do our own personal training, so I was training about 3 to 4 times a week, trying to get fit.
And you played in Fiji prior to that?
Yep.
Tell me a bit about that.
Yeah, so I made the Prime Minister's 13s team for Australia, and so we went to Fiji and got to play over there and spend a week over there, so it was really good and a really good experience, humbling experience. So yeah, it was great fun and that was probably one of my highlights.
Talk me through the recovery process so far. What has it involved?
So I started off with physio 3 times a week, which was pretty intense because you have to start getting back your bending, your flexion, and then focusing on getting your extension back. So physio 3 times a week, and now I'm doing 1 a week and 3 gym sessions a week. So trying to build back my strength that I've obviously lost because you don't really use your leg as much. So I was in a brace for 6 weeks and couldn't walk properly for about 4 of those. So it was pretty hard, but yeah, I'm slowly getting there, chipping away, and I can hopefully start running next week now, so it's pretty good.
And what impact did that have on you mentally as well?
Oh, it was a struggle. I mean, seeing everyone play sport and can't do it, it's a bit of a struggle, and going from playing a lot of sport to then not playing at all is really struggle, but alright, sorry, now I've got to make sure.
And prior to your injury, were you educated on ACL preventative strategies?
We'd heard like a little bit about it, like you kind of hear about people doing the ACLs, but you don't really fully understand or know. So we do know, like we do trainings and stuff, we do like kind of ACL prevention stuff by like hopping and like landing on your leg and knowing when to transfer different loads between your legs. But we didn't really fully have too much information about it, or you know, extra things you could be doing at home to try to prevent it.
And what else has to be achieved before you can return to full contact?
So it kind of goes by, I think there's 5 stages. So I just passed stage 2 now, hopefully. So it's just, there's got different stages and different criteria you got to meet. So as well as your bending, extension, stuff like that. And then you got to do your strength work. So I know where I am, I've got to be able to do 20 single leg squats to a bench, 20 single leg bridges, some hopping drills and some like running, cycling drills. And then I'll start straight line running for a couple of weeks or months, and then start to do change of direction and focus on that, but not too strenuous. You do a bit of S runs and stuff like that. And then I think after the 6-month mark, we can start doing contact and then go straight into it all again. And then I think you spend about another 3 to 6 months around the 9 to 12 month mark, just doing full training loads, but they just don't want you to push you back too early to just try and make sure it gets stronger and stronger.
And considering the stats about re-injuring ACLs once you've done it the first time, are you nervous to return to footy?
Sometimes I am, sometimes I'm not. I think you're more likely when you go back to redo it, or you're more susceptible compared to people that haven't done it before. But I think there's a criteria when we do return to sport, you actually have to pass a criteria to be able to do that, and that's about thinking about your leg. So I think if you're thinking about it, you won't even be allowed to play. So I feel like I've just got to get that out of my head and just focus on getting strong again and fit again.
"19-year-old Melody Nelson has grown up playing numerous sports, her active lifestyle being all she's used to. Her talent has led to countless selections in representative teams at both the state and national level. But in 2018, it all came to a halt, her soccer career with Sutherland Shire Football Association taking an instant and prolonged backseat. But after 12 months, Melody has settled right back into her sport, her approach to game preparation and recovery much different since returning. Here's her story.
Even though they did manage to fire in one shot on target, it's now Melody Nelson who goes for goal once again.
So tell me about your life growing up playing sport.
Yeah, I had a go at pretty much every sport. Mum and Dad just put me in everything. I really enjoyed soccer and OzTag and athletics and everything like that. Tried everything at school, just had a go at everything really, yeah.
And talk me through the moment you tore your ACL.
So I was playing OzTag in New Zealand, and I had the ball and I was just running up to like step a player, and as I stepped on my left foot, it just collapsed. The knee just collapsed in on itself, and I just heard 2 pops, and I was like, oh no. I was like, oh no, that can't be good, yeah.
How long was the recovery process?
From surgery, it was a year, but I had to wait like 2 months to get surgery because I did my MCL as well, so you have to wait for that to like repair as well. So all up it was like 14 months out of sport, yeah.
And prior to your injury, were you educated on ACL preventative strategies?
No, not at all. I've never been around it or met anyone that had done it or anything like that, so I had no clue.
So tell me, how different is your approach to warm-ups and games since returning to sport?
Yeah, I definitely take like 5 minutes on my own just to do some hopping and some jumping and stuff, just to warm it up really well, because Mum's always saying, like, she's like, make sure you warm it up. So it's always in the back of my mind just to warm it up and make sure it's all ready to go, yeah.
Tell me about your first game back after injuring your ACL. Were you nervous?
Yeah, first game back I was heaps nervous. I was only playing like the last 20 minutes or something. But yeah, I was really nervous. I warmed up for ages. But yeah, no, once I got on there, I was like, oh, it's okay, like, I'll be fine. and I sort of forgot about it. So yeah, being back's really good. I'm so grateful for it, yeah.
Back in your element.
Yeah.
And considering the statistics of people re-injuring their ACL, do you ever worry or try to protect it, maybe subconsciously?
Yeah, I definitely do subconsciously, like definitely tackles and stuff. I'm like, ooh, I might just not go for that one or something. Like, definitely, I do think about it. I don't stretch out as much if like a ball's going there. I'm like, oh, I won't get that one. So yeah, I do think about it a bit. But sometimes I don't even know that I'm thinking about it. It's just like my body is like, ooh.
I also had the pleasure of talking to APA recognised sports and exercise physiotherapist Mark Edgar, who works at Southern District Sports Physiotherapy. He has widespread experience, having worked across a range of sports at the Olympic Games, World Championships, international, national and state competitions. As the head physio for the Australian Women's Sevens rugby union side, Mark is proficient in the realm of elite female athletes, knowing well how their anatomy differs from their male counterparts. Having treated countless ACL injuries, Mark has great experience guiding patients through their rehabilitation process and back onto the sporting field. He chatted to me about this transition and what must take place to get there successfully.
I've been a physiotherapist for 30 years and as a APA sports and exercise physiotherapist for 9 years now.
And have you found there to be a distinct increase in ACL injuries among female patients in recent years?
Yes, certainly in the last 5 to 10 years we've had a big increase in female ACL injuries. It's definitely a big problem at the moment in women's sport.
And why do you think this is?
There's several factors. Genetically, they are anatomically different. Traditional sports that girls play as juniors, coming into their adolescent years, they start branching out now into league, union, OzTag, soccer even, which is slightly different from a lot of the way that the traditional sports were, and they're also being coached by men, and they're not little boys or little versions of men. They're actually women with different anatomical and different strength differences, and that hasn't been addressed properly.
And what is your main priority during the recovery process for ACL patients?
Initially it's to get full range of movement, particularly full extension of the knee afterwards, and then it's a case of getting back strength and coordination and therefore function once they regain their full strength.
And what is it that you demand your patients do upon returning to sport?
Before they get back to sport, they have to show good side-to-side similarities and strength. We shouldn't have any significant weaknesses. We need to get them to have good function, and we need to do a lot of polymetric, one-legged, jumping, bounding, landing activities in order to prepare them for their return to the demands that their individual sport might put on them.
Having worked with the Australian Women's Sevens team and as the head physio to the Southern Districts Rugby Club, have you found that ACL education has been of standard?
Not of standard, no. There is certainly ACL prevention strategies and programs out there. Each individual sport has their own. There's FIFA 11 Plus, there's the knee program in netball, the FIFA 11 Plus is soccer, there's a PEP program for rugby. All those programs have been shown to reduce female ACL injuries by a minimum of 45%, so almost half, so a significant difference. However, the programs are out there, they need to be followed, but again it's up to the coaches or the individual codes and clubs whether that's actually incorporated into a warm-up or actually a prevention strategy. The information's there, we know it works, but whether it's actually implemented, that's a different story.
On average, ACL recovery period following a reconstructive surgery is around 7 to 9 months. Many athletes tend to wait 12 months before fully returning to play to ensure the new graft is fully healed and can withstand the repetitive stresses of sport movements. But at times, athletes are too eager. Research shows that 1 in 4 individuals who are of a younger age and return to a strenuous sport that involves things like pivoting and load distribution will either re-injure the reconstructed ACL or injure the opposite knee. A female athlete who has endured the true heartbreak of ACL injuries is former Gillaroo star Alana Ferguson. The role model for many aspiring young female athletes was forced into retirement at the age of 25 after tearing her ACL for the 4th time. Having torn the ligament in the same knee when she was 15, 17 and 20, Ferguson knew as soon as she went down that she had done it again. After hamstring grafts were used in the first 2 reconstructions, surgeons resorted to an Achilles tendon, telling her that if she were to do it again, they can't fix it and that there is no bone left to screw into. The 27-year-old was forced to take her love for the game and find a place for it elsewhere, settling in quite comfortably with the NRL on Channel 9. New South Wales Women's Rugby League strength and conditioning coach Peter Burke stresses the importance of preparation and recovery in decreasing the risk of injury. As ACL injury reduction programs decrease the risk of all ACL tears by half, Peter ensures that his players are well educated on risk factors and preventative strategies. He prioritises form in the gym while stretching and on the field, with focus on lower body, core and landings. He gave me insight into how they prepared the players' bodies, but in particular their knees, for strenuous activity in Origin camp and on game day. As the strength and conditioning trainer for the women's Blues side, how critical is ACL preventative strategies?
We find it as a team, so the team of physios, strength and conditioners, etc., sports scientists, absolutely critical. We're dealing with elite female athletes. We've got one game to produce the goods. We need to make sure that we treat the girls extremely well. We make sure that we minimise injuries. We realise that there's a really high prevalence of ACL injuries in young women, so we take it very, very seriously, and we basically don't want them to occur on our watch.
And how exactly do you as the coaching staff educate your players?
Okay, so we sit down with all of them. Most of them do come from NRL clubs, so they have been educated a lot on the topic.
And in Origin camp, how would players prepare their bodies, but in particular their knees, for the strenuous sessions? Okay,
so firstly, for the gym sessions, a great deal of activation, mobility, then into hops, then into the gym work. Okay, so the gym work targets the lower body, okay, and the hops and power and so on. The key elements that are needed for the game, and in particular in the game on the night. So for field sessions, we always start with a bit of fun, bit of tennis to lighten the girls up, etc. They think it's just fun, but we're trying to get their core temperatures elevated, warming up once again their muscles, ligaments, tendons, and then pretty much into a more structured dynamic warm-up. Then a more game-related warm-up, where involving the wrestle and upper body and so on. Basically getting their knees ready for the game that it is, the high contact game that it is.
And briefly talk me through the game day warm-up.
Okay, so game day warm-up, obviously there's no fun stuff on the game day. Game day is highly intense, stressful for the girls, etc. So we start with breathing. So the captain, Kezi Apps, starts with that. The girls breathe. Kickers, catchers come out. So they get 5 minutes to kick and catch, get their bodies ready to kick. Particularly for the kickers, getting their knees ready. So they start off quite easy and build. The catchers, obviously we know the incidence and the prevalence of these injuries has a lot to do with the landings. So the girls practice their landings, turning, landing one foot, landing the other, very specific to the game. Then the others come out and we start the dynamic warm-up. Okay, so basically it involves a traditional dynamic warm-up involving like dynamic movements, lateral movements, hops, etc., specific to the game, so that they really warm their bodies up. After we finish that, we then go into more game-specific stuff with ball in hand, passing, catching, collision, takedowns, etc.
And how important, in your opinion, is cool down and recovery in preventing the injury?
Extremely important, okay, particularly in camp or just in general. Very important post-game to stretch, okay, then to cool the body down. But we always believe that we train hard but we recover harder, okay, so it's critically important that they rest their bodies, that they sleep, and that there's a sufficient time for growth and repair of their muscles.
Competitive sporting environments are producing generations of athletes that risk suffering knee injuries, proving the escalating need to teach our athletes how to control the tremendous forces that they are generating while playing. And with that said, their practice must mimic the actual demands of the sport on the athlete. Though there are many factors underlying the differences in ACL injury rates in males and females, there are so many approaches to strength training, load distribution and game prep that have been proven to reduce the risk of injury. Players, coaches, trainers, physios and sporting organisations need to take a comprehensive approach to this increasing injury, placing priority on education, both in theory and practice.